Hi, and welcome back to another episode of the Mental Health Couch with me, Nick McEwan-Hall. In today's episode, I'm talking with someone I met at a course that I ran in Wodonga, Lara May. Over the last few years, I've worked with Lara to ensure that every Year 8 and every Year 10 student across the whole of Alpine Shire have been trained in teen mental health first aid. It's an amazing commitment to young people who live in a region that's had its fair share of distressing events, and it's having a huge, amazing impact. In this episode, you'll hear how Lara got into youth work, what makes young people tick, and how a regional setting can be both a protective factor and a barrier to help seeking. Lara is a committed youth worker who has young people's best interests in mind 24/7. I really enjoyed this chat and I hope that you find it interesting as well. Just a heads up, this episode does touch on themes of mental health, mental illness and suicide. Take care while listening. Lara, welcome to the Mental Health Couch podcast.
I'm so excited to be here.
Too. We're excited to have you here as well. I'm excited to have a chat with you today in a bit of a different context to the way that we normally have worked together, and we'll talk about that later. It's so lovely to have you here. I've been looking forward to this conversation for a little while. Let's get started by getting to know you a little bit better. Tell us a little bit about your background. What's your story, Lara?
Yeah, I grew up in Melbourne, but I was quick to get out of there when I turned 18 and I started in the winters. So I did winters up at Falls Creek, which I can see just over the valley here. And then we would go to Japan and do the winters over there. And I was a supervisor in a rental and retail shop, and I worked with people every day, and I absolutely loved that. But when COVID hit, we basically got kicked out of Japan. Either stay in Japan for who knows how long or boost quarantine and get through it. So that's what we did. We just came home and had the opportunity to buy a house. And I guess that's when the big girl job hunt started to afford a mortgage. That's how I led my way into youth work. I was fortunate that I knew someone already in this sector, and she tapped me on the shoulder and was like, hey, there's an entry-level position. You don't need anything and you can study while you're doing the work. I was like, oh, done, let's do it. And I was successful in getting that role. And from there, I then progressed up to being a youth worker, and I've just been loving it. I love everyone I work with. It's been such a journey. The last 5 years has just been mental.
Wow, that's amazing. It sounds like the COVID thing, it was a bit of a lucky strike that kind of happened and forced you to come back home, but then all these things opened up once you were back.
Absolutely. And I think the stars definitely aligned for us. We got so lucky. And I think a lot of people were kind of stuck in the valley as well. So we had this really lovely kind of orphan community where no one had their families around. We all just had each other. It was really lovely. I think that was honestly my first sense of that community-driven mentality. Growing up in Melbourne, we didn't have that. It's been quite lovely stepping into the community development space and being able to recognize that. I think it's really cool.
Yeah, amazing. That's interesting. Yeah, that COVID experience was so unique for everybody, but I can only imagine what additional uniqueness being in the setting that you're in brought, like a small community, sort of remote area, different settings, I suppose, too. That sense of community building that happened through that experience sounds pretty incredible.
Yeah, absolutely. I had a great time being in lockdown in Mount Beauty.
Well, it's a beautiful place to be. Mount Beauty lives up to its name, that's for sure.
Absolutely.
I've been out there working with your crew. It's a really beautiful part of the world. And now that you talk about the COVID experience, it's like I'm sitting here thinking about, my experience of Mount Beauty and even just broader Alpine Shire and what that's been like. But I'm not sure I can quite imagine what it would have been like in a COVID setting. It's kind of interesting. Yeah. I'm in a beautiful place to do all that stuff we all had to do. Wow. Really interesting. It sounds like that story was part of the pathway for you into the work that you do. You mentioned you got tapped on the shoulder and said, hey, I think you'd be good for this. It doesn't require any kind of quals or anything. You can study.
Yeah.
Tell me a little bit about that. How did that unfold for you?
As I mentioned, the stars just aligned for me. I was working at Falls Creek at the time. It was just absolute mayhem. I was grinding and yeah, this opportunity just fit my personality so well. And I was like, it'd be silly not to really. It's a full-time job in a small regional town. There's really not a lot of those going. Yeah. So I applied, I was successful. And I guess that's when I started my work within that comm dev space. I'm just so grateful for the path that it's taken me on. Starting the role, it was definitely more, you hear youth worker and you think a support worker.
Yeah.
But when I started, this role was definitely more youth events. And I think a lot of youth workers in the Victorian area will go that freezer funding, engage funding, all that typical youth funding that we all get. It's all youth events driven.
Okay.
I think it was really important to make sure we hit those KPIs, but also recognizing that we could make these events to be something more meaningful and helpful rather than just gatherings.
Yeah.
So yeah, I guess that's kind of how our relationship started.
As you say all that, it really talks to that idea of the role, right? Community development. It's not just bringing people together like doing a bowling afternoon or whatever. It's actually bringing people together for the purpose of developing community and connection and those sorts of things.
Yeah, absolutely. I think events do so much for our community, and they're especially after COVID and bushfires, and we've been through it up here. And
we really have.
Events alone are magnificent. For me, especially someone that has also struggled with mental health, it's been important to give this education and support to the young people within our town as well. Do my very best to try and implement as much love as I can.
I think that comes through with the work that I've done with you as well, and the chats we've had over the time as well. You know, passion, and I think the word passion gets thrown around a little bit, but when I think about how we've worked together in the past and the conversations we've had, and from a perspective of what are we trying to do, what are we trying to do? There's always the work, but then it's like, what are we trying to achieve? What are we shooting for? And that's where you're so connected to your community, and you can just feel that when we're working on those sorts of things. I think you do a fabulous job for your community. From my perspective, I know what this stuff takes in terms of hard work and all of that. So yeah, interesting. All right, cool. So it started as events, but it seems like it's morphed into other kinds of things over time.
Yeah, absolutely. And I think, like my first event, we had a colour fun run, and we kind of made that around mental health after the bushfires, what was important after the bushfires, and recognizing that young people were really struggling and they didn't have that control during that disaster. So how can you bring back that control? That's supporting them in their physical abilities, so their qualifications, their upskilling, but their mental and how they can control what's going on in their mind and work through that situation, but also recognizing it for their friends as well. Yeah. So that's kind of the Colour Fun Run was our very first event, which I was like, oh, we need mental health stuff. They need this. Then ironically, I went and did a LGBTQIA plus mental health first aid course and met my very good friend.
Yeah, that's how we met, isn't it? At the Rainbow Youth Mental Health First Aid program that you run. That was in the Wodonga program, right?
Yeah, which wasn't too long after I had started. It really shaped my work. Honestly, I'm grateful for you.
Oh, that's lovely to say and to hear. It's funny, as you're talking about that, I think, we run programs all the time, and that's fine, and we have people in the room, and it's always great. But I never really, until I sit down and talk with people, I never really get context about that. So when you just said, that was just when I started my role, and everything we've been talking about so far, that kind of context, and then I think about, you came to that program at that time to learn that thing in the context makes so much sense.
Even just the people that I met in that training with you, just the other participants, the amount of times I've bumped into people from that training, which was 2 years ago, seeing them in the sector as well. It's just kickstarted so much for so many people. And I think you should be really proud of the work that you've done to help support other youth workers. It's pretty magical.
Oh, that's really nice. Thank you. That group was a really fun group. I interviewed Olivia Brozecki, who also was in that group for the podcast a little while ago. They said similar things. It's lovely to hear that. It's a good reminder for me too, I think, now just sitting here reflecting, it's a good reminder to pause. You might have a similar thing, but in the busyness of doing programs, events, and running things here or there, and it can be easy to lose sight of the impact that's being had as a result of those things that we do. I'm sure that must be the same for you in your role, like being so busy and doing things and sort of needing to take time to pause and reflect on, what is the actual impact of what we're doing?
Absolutely. I've actually recently implemented this thing for myself, which I wasn't planning to talk about. My view out my window is of Mount Bogong, Victoria's highest peak. It's absolutely majestic, but I've just been so prone to seeing it every day. So every time I get a glimpse of Mount Bogong, whether it's driving over the hills or I'm in my lounge room and I look out my window, I take a deep breath and I kind of appreciate what's around me. And I think taking that moment has helped me reflect a lot on not only my own mental health, but what I've been doing and how I've been impacting this community. It's pretty cool work that we do, and you don't realize until you have these conversations, I guess. You're right.
For sure. It reminds me a little bit of teachers. Teachers will say, oh, teaching is really stressful. I love my job, love the kids. It can be really stressful. Later down the track, they'll bump into someone they taught in year 6 at the shops. That young person will say, oh, I always remember this, or that thing you told me. We don't often get to see the impact until further down the track, particularly with young people sometimes.
And I think also as teenagers, my age demographic that I work with is 12 to 25. There's puberty, there's the age difference between 12 and 25. You're a kid and an adult all at once. And it's the development within those years is outstanding. And so seeing the way that has developed, a really amazing group of young people, and I started that work with them 2 years ago when they were 16, and now they're 18, and they're just such different people. They're wise. It's just magical. It's really cool to see that growth.
Yeah. And you're right. The difference between a 12-year-old and a 25-year-old is just so huge. Like, so much happens in those, 12 years, 13 years, whatever it is. And I think we do lose track of that sometimes. We lose track of just how diverse that cohort is. If we just say adolescence, right? That diversity in that age range, both in terms of their skills and their abilities and their cognitive development, all the things that we know about, mental health included, and how we deal with that stuff is so different from one end of that spectrum to the next.
Absolutely.
You mentioned before that, your area's really been through it. So bushfires and, all the stuff. And you mentioned there that, that stuff all had a big impact on mental health, particularly for young people in your area. Tell us a little bit about how that is. I think people listening might not have had those experiences. What is it about that experience in particular when we think about young people going through that experience? How does that affect their mental health? Tell us a little bit about that.
Yeah, there was a research around the bushfires, and what was most damaging for young people, it was that autonomy and not knowing where they're going to be, and dad running off to fight the fire and mum packing up stuff and not telling the young people in the house what's going on. It's scary. You need a little bit of clarity in that stressful moment. I think that's the start of it. And I think recognizing that, like, teenagers especially, they're way more, well, they're heaps tougher than you think, especially when they're babies and you're in a disaster and you just want to protect them. But I think protecting them it's that transparency of, this is where we're going, this is what we're doing, and I need you to go and put tennis balls in the gutters or keep occupied. That's often forgotten, not having that control over a situation, and all you have is your head. Your head's just ticking and it's what's going on. I think that's the start of all the mental health struggles that came through during those bushfires. We have an extremely strong community around here where we're so connected. Everybody knows everybody. You can't walk down the street without saying hi to 50 people, which is so lovely. And I think it's times like that that's the most important, just knowing the people around you and where your neighbors are. I think it's just that understanding of what's happening in an emergency.
Yeah.
I don't know if I answered your question then. I just went tangent.
That's totally fine. Now I'm trying to remember what the question was. The question was about these scary experiences like bushfires coming through towns or whole shires. How does that show up in terms of a mental health effect for young people? And that story you told about, sometimes parents or other people, not just parents, but people around young people want to protect them. And the way they express that is, well, you just don't worry about that. It's like, well, actually, that young brain kind of needs and wants the information. And sometimes withholding some of that stuff isn't going to be the best thing for that young person. Other times it will be. And that can all change as well, right? You make a really good point, because if people want to feel safe, they need to understand what's going on around them and how they fit with that, so they can
Yeah.
have that sense of control or agency to know what they're doing, why, and what the plan is. And yeah, it makes total sense.
Yeah, for sure. It's such a simple thing that it's been blowing my mind being in this role and seeing no expectation for young people. When they come to the table and deliver and they do some really cool stuff, everyone loves it. It's incredible, but I think we also need to give them some credit. They are stars and they're doing some really cool work.
Yeah.
It's time to recognize that. It's a
I think
tricky one, I guess.
Yeah, that's where my mind was going. It's a complicated thing, isn't it? Because we've got dynamics here of wanting to protect young people, which is nice. It's a nice thing to express care and concern and protection for young people. But I suppose the bit where we get stuck a little bit is like what that looks like and how that it can be done effectively depends entirely on the young person we have in mind and
Absolutely.
what their capabilities are.
It's different for everybody. And I think everybody's circumstances and age and their family dynamic comes into play. So it's definitely not an overarching rule, but I think we need to give a little bit more credit where credit's due sometimes.
Yeah, totally. Yeah. And look, the young people that I've worked with in my kind of work, and I'm thinking about the young people up your way across the Shire there, they are incredible. Like, they are incredible.
I'm so jealous of them. I want to be as cool as them.
I was just thinking about that. What was going on for me when I was that? Was I that cool? Was I that clever? I don't know. Maybe it's that thing of like, when you're in it, you're like, give it to me. I can take it. I can do it. I want to get involved. But then as an adult, you look back, you're going, wow, look at all the things I can do now. Does that look a bit dull? I don't know. But I think a lot of people do it. They're like, oh, I wish I was that excited and clever when I was a young person. It's like, oh, we probably were.
Yeah, exactly.
And so
it's quite lovely. Go for it.
No, you go.
I was just saying, like, it's quite lovely that I think that old school mentality of, you know, kids are supposed to be seen, not heard, has been thrown out the window. It might just be my little bubble of youth work and me talking to youth workers that all have the same mentality as me. But it's really nice to see that mentality pushing away from where we are and giving that opportunity for young people to speak their voice, which is really lovely.
Yeah, you're so right. And I often wonder where that's come from. How did that start? Because if you think about all the stuff that's happened over the last couple of years, high school age students going on strike, you know, climate strike, we're going on strike, we're not going to school, we're going to protest, you know. And it's like, wow, like that's something I could not fathom happening when I was a young person. But when I look at that, I think, well, that's not something that adults have told those young people to do. That's something those young people have grabbed hold of and gone, we think about this in this way. We're not happy with X, Y, and Z. This is what we're doing. And I think that's incredible, because if we're going to think about young people being super empowered, we need to leave the power of that story with them because they're driving it. And there's a lesson there, which is, hey, adults, why don't you just get behind young people and help them do what they want to do?
The internet's got a lot of bad things going on, but if it's got one good thing, it's that young people can find empowerment from people anywhere in the world and support one another. So I think, like, that's the one thing internet's got going for it.
Yeah, it's true. I've heard lots of stories where online has been the space where young people actually find their crowd or their support or their tribe. And if we take that away, then they don't have that ability sometimes. And I can imagine how that is, especially the case in a regional area, right? Like where, you know, being in Melbourne, you walk down the street and you go, there's my people. But smaller community, you don't have that opportunity. So the online space becomes transformational for young people to see what they can be, to see what's possible, or to hear other ideas.
I think if we even look at that queer space, that LGBTQIA plus community, it's like, unfortunately here, you make a post about something rainbow and it gets bashed online and it's just absolutely awful. How can you feel safe in your community when you don't have other people around you that identify the way you do? And how can you feel confident in yourself if you've never seen anyone else go through that? It's really beautiful to have that connection to even just those smaller communities that aren't so welcome in rural areas.
Yeah, it's so true. You mentioned before about the disaster stuff that's happened in your area and the impact it's had on mental health for young folk. How do you think that mental health story is being told now as a result of what's happened over the last few years? What's the impact been if we think about it now that you're through those disasters in that space of recovery? How is the mental health story showing up for young people now as a result of that?
Oh, that's a tricky one. I'm not 100% sure if I'm honest with you.
Okay.
However, my coworker and I, we've recently opened a youth hub, and it's been a magical place to welcome all the young people in and have a safe space and just have a lot of support, brochures and condoms and games and fidget toys, snacks, most importantly, snacks. Absolutely. That always gets them in.
Critical.
In that space, it's a great spot to be vulnerable and open up. Not that you have to do it with everyone, but there's breakout rooms and an opportunity just to pull myself or my coworker aside and vent. We can direct it in the right direction. We're still in our pilot project, so I can't really put my finger on it, but the younger students that have been trained versus the older students that haven't been given the tools, it's very evident. It honestly makes me sad because we've got these teenagers going through exams in year 12 and it's really scary and it's difficult and the workload is so hard and high. There's no way to get through that. So I think it's too early to call it, but it's definitely something that I've recognized that I would love for these students to have the opportunity to do that training.
The youth hub sounds like a really beautiful space. Like it just feels like a really nice kind of thing to have for the community, but also this impact that we were talking about, being delayed, and we might not see it for a couple of years, but we'll see the fruits of that labor later. It sounds like all that stuff's happening as well. Yeah. Okay. Well, it sounds like the story that is so often the case with mental health stuff. This stuff takes a while, if you think about a traumatic event, we know how that works. It can take a long time.
Not instant. And I think we're so used to that instant gratification that we almost get impatient. Going back to my taking a deep breath when I see Bogong, just kind of being a little bit slower and doing our best to slow down and see the changes as they happen has been really cool to reflect on.
Yeah. Nice. That's really nice.
Oh my gosh.
You're allowed to be cheesy. I think we know the basics of what works for good mental health and well-being, and things like you're talking about, like taking a moment, being grateful, slowing down, connecting more to what's going on right now. These are all the things that we know are good to do, but who does them in reality, unless we sit down and we actually go, that's what I'm doing. And this is why I'm doing it. If it feels good and it's useful and it's constructive, that's good for us. And as someone who works in the youth space, role modeling that for young people is pretty important. It goes back to that conversation. I can't be what I can't see. So if I see, if I'm a young person and I see Lara doing a bit of mindfulness every time she sees the mountain, that's a nice thing. It's a protective factor for that young person. So I don't think it's cheesy at all. I get how it can feel cheesy for sure, but I don't think it is. You mentioned for the young people that have done the program we've been working on the last couple of years, you've seen a bit of a difference there. Let's talk a little bit about that program, because it's a bit of work that I'm super proud of, but for a lot of reasons.
Awesome.
Thank you. And as should you and your team, right? Like we should all be proud of work that's been going on. But take us back a little bit. We met at the Youth Mental Health First Aid Program, the Rainbow Youth Mental Health First Aid Program in Wodonga as ago. What was the process from there, thinking, actually, this is something we need to do with our high school students?
Yeah, so I have some mental health funding from my organisation that was used years ago. The original facilitator just didn't have the rapport with the students that is so important when you're talking about mental health. And it was canned pretty quickly. It was kind of just shoved aside. It wasn't beneficial. It wasn't giving the results that they wanted. And so they canned it, which is honestly valid. Why would you do it if it wasn't helping?
That's right. Yeah.
And so when I came in and I did your training, I was like, oh my gosh, every human being in the whole entire world needs to hear Nick talk about mental health.
Form an orderly.
I came back and I was like, everyone needs this. We need to get this into the schools. That's when I sat down with my manager and we formulated a plan of getting every single year 8 and year 10 student trained up in mental health first aid. And then by the time those year 8s get to year 10, they'll get that refresher course again. I think year 8 is a really great preliminary age where they can start to hear those buzzwords or take in this information, but maybe not completely use it. And then by the time they get to year 10, it's solidified and they can start to use it in their day-to-day life. You can definitely see it in those year 10 students that have been trained up. We are so fortunate that we have that funding. Going forward, we're also going to work with other community groups and pull some funding from different places, and we're going to make this more of an opportunity for the rest of the community to see what we're doing with our students. Having hundreds of thousands after a couple of years of young people trained up in this it's just a huge project. And I think the rostering with schools is so difficult, and I absolutely praise the teachers that they've even been able to fit. It's just so important, and I'm so grateful that they've had the opportunity to do that.
You're right. The timetable in a school is just so pressured without it adding anything above curriculum. It's just so pressured and so difficult. So I think you're right. The schools in your region have been super helpful and cooperative to get it up and going. It's not an easy thing to do. And we're talking about 4 schools trying to get this stuff done in a similar time frame. So it has been tricky. It's been interesting too, working with that breadth of ages across the region. The year 8s and the year 10s, we would expect them to be different, right? They're different ages, different development, different cognitive abilities, those things. We'd expect that.
You've seen that firsthand, like working directly with those different year levels. I'm sure that you can recognize the intake from each year.
Oh, totally different, way different. And we'd want them to be different. You know, like when I think about that, it's like, yeah, I would, and that's a bit rose-colored glasses sort of a statement for me. Like you'd want them to be different. And what I'm thinking about there is to say, well, yeah, I would really like it if year 8s didn't need teen mental health first aid skills so they could support each other with each other's mental health. The reality of what we know about young people and mental health is not a pretty picture. And that's the backdrop to which this whole kind of work's been played out in front of. We have this ongoing evolving story about young people and their mental health state. And then we layer on some regional stuff, we layer on remote, we just kind of know what's going on. I'd love it if year 8s didn't need to use it. But from the first year that we ran the program, there were so many stories that stood out to me about young people asking really clear, pertinent, insightful questions about this stuff. And they were the year 8s. Yeah, they were the year 8s kind of going, I'm dealing with this and is this okay? And, you know, that sort of stuff. And yeah, it's happening for young people. I think it has been very evident to see the need. For me, it just kind of brings life to the stats. We know the stats, we know them. No, it's all right, go for it.
It blows my mind reading these stats. It is really devastating. And you're right, like working with the young people, it really does bring life to that. You might have a leader of a student that's just flying through doing awesome work, but their story behind closed doors or behind their eyes is just nothing that we could ever prepare for. And it's really interesting in youth work because they're always like, oh, what about those youth that are graffitiing? They need the most help or blah, blah. And everyone needs help. Everyone needs love and support. So it's just those comments that I'm just like, you don't even get it. You see this leader, but that leader needs that support just as much as that kid does.
It reminds me of a funny joke, like when I do youth mental health first aid courses and we talk about what's going on for young people during adolescence, I'll turn to the room and say, so has anyone here been an adolescent before? And the room will go quiet. It's like, no. And I'm like, really? And they kind of get the point. And the point is, well, we've all been through this. We were all, as human beings, all had the same developmental story that was influenced by our context and all that. Or yes, but all these things did happen. So sometimes it does mystify me a bit when we sit in adulthood and we kind of go, oh, these young people, you know, it's like we don't understand them. It's like, some of the stuff that's going on for them is the same stuff that we went through. It might look different, but it's the same thing. So maybe what I'm thinking is that it should be easier for us as adults to have that empathy. But I
Yeah.
think there is a jump there that can happen sometimes. Not quite sure what that's about, but yeah, we've all
And
been through it.
like for me, someone recently asked me, they're like, how do you stay up to date with youth issues? What do you do to know what's going on? I'm like, I ask them. Like, why is that not an option?
Yeah.
Just talk to them. It's so
Yeah.
funny. It's like, oh, no one knows what goes on in a teenager's brain, but they're willing to talk about it. You just need to talk to them.
True, isn't it? It's so obvious, but for whatever reason we think, oh, I can't do that. Yeah, and I suppose in your work, that's your job, that's what you do, and you've got that youth centre as well, the hub there that kind of facilitates some of that, you know. What would you say to someone who was like, oh, look, I just don't know how to talk to a young person? That might not be exactly what they're thinking, but the vibe I'm trying to go, what could we tell people to guide them about how best to talk to young people? Because I think you're right. The best way to work out what's going on for someone is to ask them, particularly for young people. So what are your, I don't know, like top tips maybe? It's a bit of a question,
Ooh, okay.
but what would you say to someone if someone goes, oh, I just don't know how to talk to young people? Like, what are you going to tell them?
Well, the first thing that comes to mind is actually listening, actively listening. If you're going to ask a question, make sure you hear it and make sure that you do something about it. That's probably my number one tip.
Yeah. Is there maybe not an example of that, but like, can we give the listener something to kind of think through, like a scenario where that's been important, or even a made up kind of thing? I know what you mean, saying to someone, listen to what they're saying to understand what they're going through. And then that follow-up bit, I think some people might sort of go, well, I know how to do active listening, right? I think I do anyway.
Yeah.
But that extra bit of like, and then what do I do? That next component, how would you guide someone with that bit?
I think what I often do is putting myself in their shoes. And look, like I mentioned this to you earlier, that I honestly think a lot of the reason for my success is that I'm also a young person myself. Yeah. So I have that going for me. Recently, I've had some young people come into the youth hub, and they're stressed. Their exams are next week and it's all happening. It's go, go, go. And there's a lot of pressure. And they talk about that pressure that's been really tricky. What about the self-care piece? What are you doing to take a step away from that? Is that what's most important right now? I think just reminding them that your life is number one and your exams are for 3 weeks.
Yeah. What a reminder, right?
Being as sensitive as I can, just being there for yourself.
It's that classic thing from that young person's perspective, or the other person's perspective. It happens to be a young person in the middle of 3 weeks of exams, right? For a young person, it often feels like their whole life has been oriented around getting these 3 weeks done. So when we come in and we say, oh, look, like it's just 3 weeks, and, in the scheme of your life, it's not going to be a big deal. They're like, in the scheme of my life, it's been a huge deal. So yeah, it's that empathy bit, isn't it? It's like really trying to understand where the person's coming from, and as best we can, try and predict what that might be like given their context, right? So if we say to a young person, I think logically we should be able to sit here and go, yeah, okay, everything I know about a young person's life, like, and how achievement oriented we are about, you got to do well at school and study and the future. If we can logically put that stuff together, so we should be able to empathize and go, yeah, well, if I come in and say, actually, look, it's just 3 weeks of your life, it's not, not the biggest deal. We should be able to predict that that's not going to go down well, but somehow we can't, or we don't. So that advice is really good, I think, in terms of trying to really seat ourselves in that person's shoes, looking through their eyeballs, thinking through their brain and trying to predict it. And if we don't know, we just ask them, what's life like at the moment? How's school going?
A lot of the time they have other shit going on too. Sorry, I don't know if I can swear. There's usually a parent that's pushing them really, really hard. Just recently passed. There's other things going on, and I think we need to remember that as well. They're stressed about this, but that's where their main focus is, encouraging a moment to take a step back and think about how you can help yourself, whether that's going for a walk with them in the sunshine for 2 minutes because you have to get something from your car, encouraging that movement. It's a bit sneaky, but it's
It's ninja moves, right? I like to think about the things that we think of being sneaky as like, actually, this is just really savvy, clever support. Like, that's what it's about, right? Like, that's actually what we're trying to do. Yeah, those little tips are great, Lara. They're really refreshing for us to think about in terms of how do we engage with young people in particular. But, as I think about it, a lot of this stuff is so universal. It's just like, how do I support someone else? How do I talk to someone else? There's not necessarily a bigger barrier because the person's a young person.
They're not aliens. It's fine.
It's true. Yeah, it's really true. Yeah. And so you were saying before that you've noticed that the young folk that have gone through the teen mental health first aid program kind of responding differently to things, or that, you can notice it. Is it just in terms of how they're kind of handling some of this challenge that they face, or like what's the kind of pattern to that? What are you noticing in general terms? Like, we don't talk about specific people, and we, in planning for the podcast we talked about, we want to protect privacy, but I'm curious, how does that show up? What's different?
That's a really good question, Nick.
Might be hard to put your finger on, but you've noticed
really
it, right?
is. I have noticed it. And I think what I've noticed the most is not the mental health support for themselves, but the way they treat their friends and what they have
got it,
what they recognize in their friends and what they can do to help support that friend. I think that's maybe what I'm seeing most, is that connection with one another and not just being in silos and dealing with that shit on your own. Like, it's a community. We all need love and support. And I think using those tools and those features, I actually saw someone carrying your book around in their bag the other day.
Oh, really?
Love that.
Well, that's a big book.
It's really sweet, just like them being able to use the tools in their everyday life. It's not like textbook. It's, oh no, I can just have a conversation, and it doesn't mean that you need to follow a set of rules or anything. That's probably what I've seen the most of.
And that's so nice to hear, because the focus of that program is to teach young people how to help their friends when their friends are going through things. And the kind of rub off of that is better self-regulation, or better self-management of mental health stuff, hopefully too. We see that with the adults that we work with. When you go through the course, you have a better picture of how mental health works. So it makes sense that that's going to show up for ourselves too. But the teen program is all about, when your friend's going through whatever, this is what you should do, and this is how you should do it. So to hear you say, yeah, I'm seeing that, it's like, well, great. It's awesome. My
favorite part about the Youth Hub is that you've got all these different ages, but they're all supporting each other. And it's a really cool thing to watch, like these older students integrating with younger students, but they might be the younger annoying brother, but they're not in that moment a friend. It's really beautiful. It's something I never expected from that space. So we're very fortunate. And we've got some, as I said, some really cool kids around here that are just so wise.
That's nice. Yeah, that's really interesting. It's good to see that impact happening in that way, and that it lines up with the intended outcome when we were planning this. That's what we want. We want young people to know what to do in these situations, help each other, and know when to get someone else involved. They've got the tools and skills to kind of manage themselves and their friends. Well, not manage them, but support them, like help them out in ways that are good and meaningful.
And what do you casual?
Think? Oh, yeah. Yeah, casual, not super stressful. It's just, how do we talk about this stuff? How do we talk about mental health? Is it okay to do that? Yeah, it is. It's great to do that. So often people have everything they need to do the thing we want them to do. The bit they're missing is the tool or the model or the way or the rules. I often think about it like 10-pin bowling. When you first start, you want those bumpers up. I know the game is to get the ball to the other end, but I need the bumpers up to help me get a better result.
That's a great analogy, Nick.
You like that one?
You nailed that.
Thanks. I know I don't want to risk overdoing the analogy, but like, there's people who won't go bowling unless there's bumpers, because they're like, I don't think I'm going to do very well. I'm not going to try. I'm not going to go. So when you give people that option to have the bumpers, it's like, hey, I'll go and I'll do it. I'll hurl that ball down the alley and we'll go for it. But if there were no bumpers, they'd never start. So,
Absolutely.
and I guess the analogy here is for young people, they see what's going on. They see someone else or themselves going through whatever, and they're like, should I, or can I, or what do I do, or is it okay if I talk to someone? So we come along, we give them the rules and the structure, and we say, this is how you do it. It's absolutely fine. Do it the right way and get an adult involved. And we tell them all those things, and that's the bumpers, right? And it just helps them to get a better result.
And I think that goes back to my piece of that transparency and that explanation of, it's okay. This is what's going to be happening in this situation, just like it would in a bushfire, as it would in a mental health crisis. It's all got the same breakdown, right?
I think you're right. That's amazing to hear. That's the impact you're seeing on the ground. It's nice to do all the surveys, and the survey data tells us, they enjoyed it, they found it useful, but it's another thing entirely to see it showing up in that community setting, in that applied community development model, right? It's like, that's the development we're shooting for. Yeah, wow. That's really cool. Thanks for sharing that. Okay, we've covered so much ground. I'm kind of curious to hear, if you could just do one thing for your region, let's say your LGA, let's share the love outside of Mount Beauty, but for your whole kind of area, that would really help young people, what would it be? And it might be too hard to just give me one thing, but what's your wish list? The magic wand, if I could do this, I think this would make a huge impact for young people. What's that look like from your perspective, Lara?
For us, we don't have a psychologist anywhere in our valley. The most local one has recently left. We don't have that support. We have people that are just needing it. And especially for those young people that did go through schooling during COVID, they're not doing telehealth. No. Not an option. No. So it's that is something that I would wave my wand and have more psychs locally.
Yeah.
Obviously at an affordable price, because that's expensive.
Well, we did say the magic wand, right? So the magic wand's out. We're going free psychology for
everywhere.
Without belittling it, I think it makes a lot of sense, because if your folks in your region are needing professional supports and COVID's done the dirty on the whole Zoom thing, everyone's just zoomed out, I think a lot of people external would say, telehealth is the answer, but it kind of is, but it's really not.
And I think that's the biggest difference. You always compare metro and regional, but what about regional and rural? And recognizing that these regional cities, though it's limited, they do have those supports around them. You can walk down the main street and you can see Headspace. Yeah. But we are an hour away, and we don't have any transport, and we don't have these options. So that's so important for me to have more support agencies around here.
Makes so much sense. And maybe for the listener, we should, where you're based. Alpine Shire is 3 hours drive from Melbourne. That's the way I drive anyway. Then from where you are to Wangaratta or Albury Wodonga is probably, half an hour, depending where you are. An
hour and a half to Wang. So it's tricky, especially for our young people. We don't have regular transport into Albury Wodonga, but you can catch a taxi over to Bright to then jump on a V-line bus to get to Wang to then catch a train to Melbourne. It's part of my advocacy plan at the moment to advocate for better transport around here.
Yeah.
We're getting there.
It's amazing. It makes so much sense. Yeah. And I think people don't necessarily understand that distance challenge that happens and you don't have to go too far out of Melbourne to hit it, right? We really don't. So when you've got towns like Mount Beauty and Myrtleford, maybe less so. Myrtleford's a bit larger. We've got Bright's fairly large, but limited as well and seasonal. You've got all these sorts of challenges that exist, and people, walk down the street in Brighton, you go, oh, there's 2 doctor's surgeries. This must be fine. But not really.
You gotta wait a week to get in.
Yeah, and if you're a young person who doesn't drive, you're reliant on somebody else, all of the layers make so much sense. I think it's interesting for people to hear that, stories, examples of that, because it allows people to empathize. If we're talking to a young person in a regional setting, let's bring all of that to whatever we're talking about to say, maybe the solution is easy, quote unquote, in a metro area, but so like maybe even impossible in a different setting. If we're
Yeah.
not offering the right kind of thinking and advice to that young person, it's just not going to work.
If someone is potentially looking, let's even just go away from the mental health aspect, and if someone needs to get to Melbourne, knowing how to do that from here is an insider hack. Like, it's not easy to find that information. So just sharing that knowledge and sharing that information is so important around here.
No, it makes so much sense. So we've covered so much ground in our chat. It's been amazing and so nice in so many ways. I guess as we think about wrapping up, I want to throw the microphone over to you. The point of the podcast is to amplify good work that's happening, or amplify messages from people doing good work. And I'm curious, is there something that you want to get out there for the listener to listen to? This is the part in the podcast where you can talk about what you want from the world, either for your community or for your young people or whatever it is. Is there something that comes to mind?
I think there's so many. Well, firstly, I think we need to give young people the credit they deserve and open that space for them to talk and be heard and listened. That's probably my number one, which seems like a simple one, but it's not.
No, it's not.
Only other one would be more money for the youth sector. The sustainability of the work that we do around here, it's not sustainable. There's no funding, and unless the work is recognised more than it is, it's unfortunate. There's just consistently rotating youth workers, and how can any young people have that stability of knowing who to turn to? So give us money.
It makes total sense. Nice. I think those things will go a long way to achieving some of the outcomes we've talked about today and that we're aspiring for. That makes a lot of sense.
Thank you so much for having me. I could talk to you for days. So,
well, it's been a real pleasure. It's been a really amazing conversation. Thank you so much. I think the people who listen to it will learn so much about that regional context and young people and their mental health. The listener will get a lot out of listening to what you've got to say, Lara.
Thank you. And what an awesome platform. Please keep it up and let me know how I can get in on it too.
Yeah, we've got a few things bubbling away in the background. You guys who've done my programs are always in the inner circle on that stuff, so you'll be the first to hear about it. Thanks, Lara, for joining us today. It's been a real pleasure, and let's stay in touch, of course, and look after yourself.
Thanks.
Say hello to Mount Pogong.
Absolutely.
Take care, Lara.
Bye.
Thanks for listening to the podcast. If you've enjoyed it, please take a moment to jump into your favourite podcasting app and like or rate us. It helps us to get found by other people, and I'd be really appreciative. My name is Nick McEwan-Hall, and this has been another episode of The Mental Health Couch. Bye for now.